Hello friends, my name is Mr. Dr. Vinay Agarwal and I am working as Senior Consultant Orthopaedics and leading the Orthopedic department at SCI International Hospital, Greater Kailash Part 1, New Delhi. So friends, we are commonly seeing nowadays people coming with problems with foot and ankle, and it's a large chunk of our practice, especially as I said, people of all age groups, sports persons, non-sports persons, everyone. So the common problems we see in foot and ankle are something called as plantar fasciitis. So just to focus on this model, I'll show you what is plantar fascia. So if you see this green strip coming from the bottom of the foot and attaching from the front, running to the back up to the heel, this is a diagrammatic representation of the plantar fascia. It's like a sheath or a tissue or a band which runs on the sole of the foot, and it basically supports the arch of the foot. So commonly people have pain in the heel, and this happens because of the inflammation or injury to the plantar fascia where it is attached to the heel bone. So it's a very common complaint of people, and it affects almost all age groups, especially the people from 30s to 50s age group. Just as the usual principle of medical science applies here, we first of all evaluate the patient, we do an X-ray, do some blood tests. It has also been found that vitamin D deficiency is associated with some non-specific fasciitis and tendinitis, so checking the vitamin D is important. And accordingly, patients can be managed either conservatively, that is we give medicines and physiotherapy. People who do not respond to conservative line of treatment are advised injections. So we have a well-equipped lab where we harvest the blood cells from the patient's own blood, which are called as platelet-rich plasma, and this platelets from the patient's blood is injected under guidance of laser and specialized machines to accurately pinpoint the needle onto the site of the injury or the pain, and that platelets then act as growth factors, which allows for healing of the fascia. And almost I would say that more than 90% to 95% success rate is there with this treatment. Very rarely, I would say less than 1 in 1000 or 1 in 500 patient might require a surgery, which is a very less commonly exercised option, as majority people get well with injection treatment. So next problem again, which is commonly encountered in our practice, is the Achilles tendinitis or the heel tendon pain. So this is the tendon. If you see this structure, this band coming from, shaded in red and green, coming from the back of the leg and going up to the heel, this is the Achilles tendon. It is the strongest and the thickest tendon in the body. So tendons are structures which attach muscles to the bones, and they are relatively avascular. That means they have a blood supply is lesser compared to muscles. So any injuries to tendons usually becomes chronic, that is it becomes like a nagging pain because the healing is slow. So this is again a common problem where the tendon gets injured or tendon gets painful due to some activity which patient might not even remember, and patient usually comes with us with heel pain. So this is called as Achilles tendinitis. Sometimes you have a bony prominence in the back of the heel, and that excess bone starts rubbing on the tendon, and this is also the reason for sometimes tendinitis happening. So again, when patients come to us, we first of all evaluate clinically, make a diagnosis, and the treatment options include physiotherapy, avoiding stressful activities, medicines, and again surgical and non-surgical options are there. Usually, just as I discussed with plantar fasciitis, we can also use PRP, that is platelet-rich plasma technique for a healing of tendon injuries, and again it has given very promising results in our hospital, and also the series available to us in worldwide literature. So this is one of the options, and sometimes and rarely, if in resistant cases, we might have to do a surgical treatment where we reattach the tendon after shaving off the excess bone which is impinging on the bone. So other common injuries are flat foot. So one common condition which we face commonly in children and adults is people coming with flat foot. So this is the arch of the foot. Our foot, if you see on the inside of the foot, there's an arch which keeps the foot off the ground, and our weight goes onto the outer side of the foot. But some people are flat footed, which means their arch is lesser or there is no arch, and then the weight goes on the inside as well as outside of the foot. These people usually have chronic pain. They usually have a lesser ability to run and do more physical activities, and this is the common reason when people come to us. Also, one of the important reasons for patients coming to us with this problem is when they apply for armed forces or police academies and all, because this is a common rejection criteria for people with flat foot to not be able to go to armed forces. So again, just I want to tell you that this is a very common condition. This is not a big disease, and there is no cause to worry. Even if someone does not get able to get enrolled into armed force or anything, that does not mean the end of his career or her career. There are other career options. Flat-footed people who are leading a normal life, nothing is to be done. But flat-footed people who have a problem with foot pain, they come to us, and simple things which we can do is giving an arch support or using various options like braces and orthotics, which we advise. Some people who are very stiff kind of flat foot is there, then we have surgical options like a calcaneal osteotomy, where we cut the heel bone and shift it inwards to make the arch. So depends on the severity of the problem and the patient's complaints. So that's our one line of treatment. So another problem which usually happens in the more of an elderly age group is something called as PTTD, that is posterior tibial tendon dysfunction. It is also called as acquired flat foot or adult onset flat foot. In this condition, what happens is that there is a tendon which comes from the inside of the foot, which comes like this and attaches on the base of the foot. This tendon is called as a posterior tibial tendon. Now sometimes this tendon becomes naturally weak or naturally degenerative, and it stops performing its function of maintaining the arch. So these people start having pain on the inside of the foot, inside of the heel, and the arch, even though they were having a normal arch when they were young, they start having the arch starts falling down or settling down. This is called as a posterior tibial tendon dysfunction. So a diagnosis of this condition is very important, and it is divided into many stages. So the treatment is according to the stage. If the patient comes to us in an early stage, then we can assist the tendon from getting more and more degenerated. We can protect it, we can give medicines, and we can offer arch supports. If the patient comes to us in a later stage, he or she might need some form of a surgical intervention where we can strip the tendon or called as tendon sheath. We can repair the tendon sheath, and in advanced stages, when the arch is falling down and the patient has persistent pain, then we offer a surgical option, that is when we do a calcaneal osteotomy or sliding osteotomy. Another problem we see in a few of our patients coming to OPD are the patient coming with forefoot pain, that is a pain on the front of the foot, that is the toes. So there can be many causes of this. There could be but the common problem we find is the condition called as Morton's neuroma. So sometimes there is a bundle of nerves which get bunched up between the two toes, and this bundle of nerves starts impinging on the below the foot, and these patients start complaining of forefoot pain. So again, diagnosis depends entirely clinical. We have to examine the patient to determine the exact cause of pain. We do an ultrasound scan to detect that bundle of nerves called as Morton neuroma, and the solution is usually simple if you seek early help. So solution involves either giving an injection into the area of the nerve so that the inflammation calms down, and very rarely we might need a very small surgical option where we can just release the nerve bundle, and that's more or less sufficient for majority of the people. Besides the common chronic problems, we also deal with a variety of acute problems like ankle fractures, where any of the ankle or foot bones can be fractured. And I want to just tell you that management of ankle fractures and foot injuries is very essential and in a timely and a proper manner, because these people who are not managed properly, they usually end up with chronic foot pain or ankle pain, and that is very difficult to treat. So my simple suggestion to you would be just to always seek a medical opinion, even though you might have some knowledge or no knowledge, whatever, and there are all online options are there, but an important diagnosis and making a diagnosis, especially in case of ankle and foot injuries, is very important, as timely management can save you a lot of trouble. I hope you find this presentation useful, and thanks for your time and patience in bearing with us. So I would like to thank you, and if you have any queries, you can always click on the comment option below. Thank you very much.